Welcome to this Institute for Research on Public Policy webinar on Universal Basic Income. This webinar is the first in a series about reforming Canada's social safety net. I now leave you with the moderator of today's event, IRPP Research Director, Colin Busby.
So thanks everyone for joining the IRPP today. I'm Colin Busby, Research Director at the IRPP. And I want to begin by acknowledging that I'm broadcasting you from the unceded lands of the Kanien'kehá:ka Nation. Tiohtià:ke, Montreal is historically known as a gathering place for many First Nations. Today, we have a wonderful panel of Canada's leading academics and thinkers on social and economic policy. The panel is going to speak to what they see as the major gaps in Canada's social safety net for working age adults and the potential role for a universal basic income to address these shortcomings. David Green, and David, you could turn on your camera now. David is a professor at the Vancouver School of Economics at the University of British Columbia and an international fellow with the Institute for Fiscal Studies in London. Garima Talwar Kapoor. Hi, Garima. She is the Director of Policy and Research at the Maytree Foundation in Toronto. And Lindsay Tedds. Lindsay is an Associate Professor of Economics and Scientific Director of Fiscal and Economic Policy at the School of Public Policy at the University of Calgary. Welcome, everyone. And thanks to all of our guests for being here. Before I turn it over to the panel, I just want to let everyone know who's tuning into this webinar that they can and should ask questions in the Q&A box that you can open by clicking at the bottom of your screen. At the end of the presentations today, we're going to try and answer as many questions as possible. And if you don't feel like asking a question, but you like the question of another participant, feel free to like it in the chat box, and we're going to try to give priority to the more popular questions. So from now, for the first word on the topic, I'm turning it over to David and Lindsay.
Thanks very much, Colin. I also want to thank you to everybody for coming, and particularly thanks to the IRPP for organizing this. As usual, it's great to work with the IRPP. I think everybody here knows, anyone who's attending this surely knows that COVID has shone a bright light, not only on the holes in the system and in our society, but also on possible opportunities. And one of the opportunities that's come up fairly often in discussion is a basic income. Well before COVID hit, we were struck as a panel by the BC government to look into the possibility of having basic income as a central policy tool. We were given pretty considerable resources so that we were able to commission over 40 research papers by experts across Canada and internationally. We also benefited from extensive consultation, both directly done ourselves, but also we were lucky enough that at the start of our session was the end of the Poverty Reduction Advisory Committee, and they commissioned over 8,000 interviews with affected people. We were able to use those links and mine that data as part of everything. We also had what we think is probably the most extensive survey of opinion on basic income ever done in Canada, plus a whole bunch of work with linked administrative data, some of which you're going to see today. Us, by the way, when I say we, you can see the names on the screen. There's Lindsay and I, also Reese Kesselman at SFU, and then Dan Perrin, who was given, I think, to us in order to keep us in line, actually turned out to be just a real gift and a full co-author in all of this. When I think about what we did in the panel over this 2.5 years, I think of it in sort of three chunks. One is we explicitly went about trying to figure out how to design a basic income for BC, how it would work into the system. And what we came up with there is relevant not just for BC and not just for other provinces, but for the federal government level discussions as well. That's going to be the topic mostly of the second of these webinars. We also put a considerable effort into thinking about an alternative system, how we would go about if we weren't going to base everything on a basic income. And spoiler alert, we didn't conclude that a basic income was the best way to go right at the moment. That's going to be the third of the webinars. The other exercise we did came from the fact that when people talk about basic income, it's often brought out as a solution to a really wide range of policies and problems. And so what we did as part of our exercise was really to go through all of those different areas and say, okay, what is the problem here? And is a basic income the solution? And today, that's what we're going to talk about. We're going to sort of lay out, can you go to the next slide, Lindsay? We're going to basically lay out 4 areas, okay, that are areas where I think plausibly you would look at them and think, yeah, maybe this is a place where basic income would be important. And we're going to do our best to be even-handed. The way I think about it is, think about this as we're going to lay out what's going on in these areas. And in the background, in the back of your head, you should hear this Greek chorus continually singing, is a basic income the best response to this, only in Greek? And every now and again, you're going to respond probably by singing back, yes, this seems like that makes sense. So we're going to try to be even-handed, but at the same time, tell you why we're reaching some of the conclusions that we are. So it's less going to be a focus directly on basic income and more on laying out the landscape as we see it. And we're going to talk about 4 areas. One is poverty reduction. The second is problems in the labor market with precarity. The third is the complexity of the current system. And the fourth is the barriers and the sort of indignities of that the current system brings. So we're trying to look at ones where there's really a plausible role for basic income, as opposed to, sort of paraphrasing Andrew Coyne, we're not, for the people who claim it'll cure the common cold, we're not going to address that one. But let's start with talking about poverty. You want to take it, Lindsay?
Okay, great, thank you. So I'll just pick up with, now David mentioned the working group that preceded us, and I'll just give a little bit of background, because I know people who are not as familiar with the British Columbia policy environment may not understand where we fit into this. And I think it's important that everybody understand that the 2017 BC election, which took, months after we voted to figure out who the government was, ended up into this NDP Green Alliance. And as part of that, they set tackling poverty and setting a poverty reduction strategy as very, very high priorities. And you can see why that would be the case. BC has historically had higher poverty rates than the national rates. And the gap, of course, has been quite a bit higher in Vancouver. And in fact, BC's poverty rates rivaled what we see down in the United States, which a lot of people don't really have that context for. So moving into this 2017 government, the first thing they did was establish this committee that David was talking about. And they went around the province for about 1.5 years, consulting with nearly 9,000 people. And one of the things that they heard was some people referenced, well, I mean, let's try a basic income because nothing else seems to be working. Whereas a large number of voices were also saying, whoa, 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 if a basic income means dismantling the basic services that are already in BC, that is a problem. And so that's where our panel came out of, was after these extensive consultations, that there was this idea, maybe a basic income, but a lot of concerns being expressed about that. And so what we did when we first started was we looked at the legislation that the BC government had put in place, which they have poverty reduction legislation, came in play right around the time that the federal government moved in this area. They set targets, they set their official poverty line using the market basket measure. And so that's all sort of in place when we come in. But one of the things that we see when you look at overall poverty rates now, since about 2016, we've seen a huge reduction in the gap between BC rates and Canada rates, such that now BC is not that far off of the national average. But one of the things that this hides is, of course, group-specific rates. And I think what is surprising to a number of people is to understand that we have done a very good job of addressing child poverty. And that has in fact affected, the single parents. We still have work to do there, but the Canada Child Benefit has been doing a lot of heavy lifting. With seniors, the regime that we have with the GIS and the OAS and CPP and more women who have labor force attachment going into retirement are able to access retirement savings like the CPP. We've made some good strides in here. Where we have made no strides is single working aged adults and their poverty rates, which have not changed a lot over the period that we had the MBM 2006 to 2019. So as you can see here, single working aged adults, regardless of gender, are facing poverty rates of 30%. So this idea of the overall BC one being around 9%, singular working aged adults have a much larger poverty rate. And so this then leads you, and I'll turn it over to David here, to make you wonder about what's going on in the labor market and what's going on with these individuals as to why their poverty rates are so high. So David, why don't you talk about the labor market?
Okay, yeah, so one of the things that we did was to take a closer look at this exact group. And one of the things that comes out of that is about 20% of the poor, the single adult poor, are actually working more than 40 weeks a year. About a third are working fairly substantially during the year, but with intermittent spells. That leads to this whole question about, as Lindsay said, whether we should, how we should be thinking about the labor market as part of all of this problem. That actually is matched with something that comes up in the basic income literature a lot, which is essentially a claim that technology in various forms, through AI, through robotics, through enabling platforms like Uber, is going to turn work more and more precarious or eliminate work altogether in the end. And that means that we have to turn away from policies that rely on paid work as a way of distributing what we produce in society towards something that's not work dependent, like a basic income. This figure is about whether or not, in fact, it really is the case that we're getting more and more precarious in the labor market. These are various sets of measures that are often used to represent precarity. So the bottom line here is the proportion of workers who are own account self-employed, so not incorporated. They almost always only employ themselves. These are the kinds of people that people think about when they think about Uber drivers, for example. And the key point to here is, I mean, it'll jump out at you right away, this line has no slope. So the claim that, in fact, we are moving more and more strongly towards precarity in this notion is not true. If you're wondering whether, as we extend this line into COVID, and you see all of the Uber food deliverers, this is going through the roof, the answer is it's not. It's almost at exactly the same place as it was in 2018. The same is true of the other measures, the proportion who are part-time, the proportion who are working on contact, the proportion who are in very short jobs. So the idea that in this sense precarity is taking over is really not true. And that's important because it changes the notion of what we need to do with policy. It changes it from this exogenous force that is going to wipe us out and we have to make a big change, to asking about how we deal with the labor market in terms of something that is a very long-term problem. So I'm not claiming that precarity is not a problem. To quote Leah Bosco from the University of Toronto, this is sort of persistent precarity. But the issue is then, this is not about gig work, et cetera, taking over the economy at this moment or being about to. Now, part of the question is, well, why is it then that there's so much discussion about that? Part of it is that, that the Uber food drivers are so evident on the labor market. All I can tell you, they make, on the streets, but I can tell you they make a very, very small portion of the labor market. But the other is a sort of spillover from the US. Can you go to the next slide, Lindsay? This is a figure that I actually took from Armin Yalnizyan. Thank you, Armin. And so one of the things that you hear repeatedly is that the share of total income going to labor is on a steady decline. And that's true in the US over the last 10 or 15 years. But you can see here, if you start from somewhere around the year 2000 and start heading to the right, you can see that in Canada, it's actually increasing slightly. And even more importantly, it's at levels that are very similar to where it was in around 1968. So essentially what we're looking at is something that looks like very long swings rather than some great trend downwards. And it's hard to see making that case as something that's being technologically driven. And this is not a point that's new to us. I mean, people like Armin have been making it, Jim Stanford have been making this eloquently. This is an important point in trying to understand the context. Now, this is not to say that nothing has been happening. Could you go to the next slide, Lindsay? This is unionization rates. So if you track, for example, the blue dashed line here, this is male unionization rates in the private sector in BC, but other provinces look very similar. And you can see a long-term trend down. The other trend that is harder to measure, but seems to be going on, is an increase in the fishering of work. So if you think about fishered work, think about a big example that's come up during COVID, which is mostly women working in the long-term care sector. And in that sector, they're not working for the long-term care homes, they're working for these intermediate firms. And what that tends to do is reduce wages, reduce labor market protection, and cause other kinds of problems for the workers. That's a concern, and that's a long-term concern. But notice again, this is a trend that has started back, I mean, as far as back as this data goes, which is 1997. This is not a right now everything is turning, we must turn to something new. This is something that almost surely has to do with long-term labor market regulation policy, and therefore is probably the place we need to be looking. Lindsay, so now we're going to turn to thinking about, let's skip the recap. I think people got it. And then we're going to start talking about some of the issues with the system that's meant to address some of these problems.
Yeah, so this is kind of where, you know, we start understanding some of the statistics, and then we wanted to see, like, what does the social safety net look like in Canada? And so what we did was we worked very closely with the government of British Columbia and surveyed all of the programs that they have available that could be considered either income support or services support. And then we paired this with information from the government of Canada to get this fairly comprehensive view of the social safety net. Now, it took us a little bit to find a visual that worked. 192 lines in a spreadsheet was not cutting it for us to sort of get an understanding of what this looked like. And so this is, I mean, we experimented with a lot of things, and this is what we ended up with, was trying to get an understanding of who offers what, not only with it across governments, but also within government. And so what you have here in the, I guess that's pink. Bright pink is the government of British Columbia. So that side of the pinwheel is the government of British Columbia. The lighter pink is the government of Canada. And then we move out from there in terms of the next layer is what ministry is responsible for these programs. But then the third one is where do you access it as a user? Because just because it's offered, say, for example, by the Ministry of Finance in BC, doesn't necessarily mean that you as the user access it that way. And so we wanted to get an understanding of what users were seeing. And as you can see, where you access it actually increases the number of different access points for an individual to be able to access all of these programs. One of the things we found interesting was, of course, the number of times we actually had to go back to these governments to say, hey, you didn't tell us about this program. Do you have any information on it? Because they would also forget about the programs that they were offering, because there's just so many, and because of the different access points, sometimes they're not as aware of their programs because they are the access point for them. So as I said, you know, we have more than 190 programs strewn across different layers of government with multiple access points. And it really gives you a sense of the complexity of the system. And so you can appreciate that there's going to be barriers to accessing these programs. There's going to be gaps in people being able to access them, but there's a lot of programs out there that already exist. And the reason why there's so much complexity is heterogeneity in need. People are different. People have different needs. They have different needs through different life cycles, whether they are young with a young family, whether they are seniors, whether they're working aged adults. All of these are leading to the complexities because people are complicated. The other thing that we did was then grouped programs by whether or not they were a cash or an in-kind program. And this one actually really influenced a lot of our work, because what we see is, so the greener the color, the closer it is to cash. So a dark green is a pure cash transfer, all the way up to the brown, which are more services. And here what you can see is the federal government is a big player in providing cash transfers, whereas the province, and in this case, British Columbia, but you're going to find a similar situation across all the provinces and territories, is that they are more likely to be in the in-kind, so basic services model. And in fact, in BC, the only really big cash transfer program is income assistance. That actually, and if you want, you can go to our website, which is bcbasicincomepanel.ca. We have all of these visuals up there, and we also have visuals that show the size of the programs, so you can get a sense of, you know, how big these programs are. You quickly lose a lot of programs because a lot of these very specialized programs are small in terms of the amount of support they deliver, but the support they deliver for those people who need it, such as medical equipment, it is a very important program for them. So then what we did was look at, okay, so if this is our support system, what are the theoretical benefits that they can receive? And here we're focusing in on cash transfers. So this isn't necessarily what a person does access. This is theoretically what is available if they are able to access all of these programs. And here you can get an understanding of why we see such large poverty rates for single working aged adults, is because there's just not a lot of programs available for them, unlike for senior single parents or couples with children, where the Canada Child Benefit is a very substantial program for people. For single working aged adults, there's just not a lot available for them to help them lift them up to that poverty line, which we're showing there. And in fact, the maximum amount of benefits that they can get is about $10,000, which is about 40% to the MBM. So there are a lot of gaps there for that group of individuals. If we focus in on a person with disabilities, here we're seeing there is more support available to them, but it still doesn't quite get them up to the poverty line unless they're a single parent or a couple with children, because again, the Canada Child Benefit is doing a lot of heavy lifting for the benefits. So here you can start getting a sense of, okay, if we're able to access all of those programs, we do in fact have a lot of gaps that we have to fill in for single working aged adults. And I have a few more slides, but David's going to talk about barriers to access, which plague not only this system, but which would also be of concern for a basic income. Well, one of the things we thought was really important was we took a look at income assistance caseloads in BC for the period of time that we had data for. And as you can see, income assistance is much more of a program that supports people with disabilities, that has increased over a period of time. It has a lot to do with eligibility changes and what have you. But this idea of income assistance being, you know, a program for single working aged adults that are able-bodied, it's just not true. It's mostly a program. And in fact, when you add in some of the other categories that are like the expected to work caseload in BC income assistance is about 8%. The rest of it, the 92%, are people that are not expected to work, whether that be they are in the disability category, a person with multiple barriers, a single parent with a very young child. So there's just not a lot of individuals in income assistance that are that stereotypical. We're supporting them while we get them back into the labor force. Okay, David, why don't you talk about this one, because you know the history of it better.
Yeah, so this is actually from a paper of Collins with David Gray. This shows the proportion of people. This is to relate things back to the federal level and to sort of tie back in this question of the single adults, lone adults not having supports. This is the ratio of beneficiaries to the total number unemployed, which Colin and David argue is not a great measure, but it still is the one that's often in discussion. And most strikingly, it has this huge drop between 1990 and 1996. Say, can you go back one, Lindsay?
I don't know.
Sorry. That big drop matches the big run up to the left here in the blue line. Essentially, what happened was Essentially, what happened was the feds, largely not because of self-employment stuff, right, as you'll see in David and Colin's paper, but largely because of disentitling quitters and some other rule tightening, got out of the business of supporting some of these people with more sporadic employment patterns. The provinces inadvertently found themselves with that caseload and then decided they couldn't afford it. And in every province, and you can see it here in BC, they cut back substantially. And that leaves us in the situation where we are now, where neither the employment insurance system nor the IA system, because as Lindsay said, the IA system is really effectively a disability system almost entirely, that neither system is there for them. If you go to the next slide, Lindsay, then this is a sort of list of the sort of things that were done in order to close this down. Okay, so one of the things that the BC Liberals did in 2002 was they moved the application forms online, which if you tell anybody who's not in public policy that you have to apply online for income assistance, their jaws hit the ground, right? If you go one more slide, Lindsay.
Mm-hmm.
Oops, no, it's not there. Never mind. Go back. At the same time, what they did was they cut the number of offices in half. So big reductions in the number of offices where you could actually walk into and get help. Movements in particular, now what happens now is you walk in, you apply, they tell you to go away and search for a job for 3 weeks, come back and prove you've done that, then you get benefits. It used to be 5 weeks that you had to do this. So essentially all kinds of barriers have been put up. So what Lindsay showed you as the potential for what you could get in the system is actually much less than people actually get in the system. At this point, probably your little choir of basic income is the right response is probably singing loudly. Like, oh, well, we should get away from this kind of system. But we want you to pay attention to the complexities that would come from the alternate too. That is, could we deliver this through the tax system as it exists now? Well, about 14% of Canadians don't file taxes in a year. That comes partly from work from Jennifer Robson and Saul Schwartz, but also work that we did. And then we linked tax and census records to death records and found that about 4% of people who are in death records are not known to the tax system at all. Also, there's obvious issues with responsiveness during the year. So that system in itself has barriers. And if you go to that, you're going to miss a whole bunch of people there as well. And I'm going to turn it back over to Lindsay just to sort of pull everything together.
Yeah, so what we want to talk about here is the gaps in the social safety net. It is very, very clear that a prominent gap is programs to support single working age childless adults. And we have to be very, very careful about making this assumption that they are poor because they are not working. In the most cases, they are just not able to work or able to work continuously, either because of an ongoing disability or a condition which, like multiple sclerosis or mental health conditions or addictions interfere with a long-term attachment to the labor market. And as David said, we especially amongst women, this rise of fissured work, and that leads to a lack of benefits, very important benefits, including sick leave. And very, very high levels of precarious work that are just not, you just don't see because they look like employees. And then when they confront this system, it's complex and there are substantial barriers, and a lot of those barriers are erected because there is a very large cadre of the population who believes that the system must be paternalistic in order to prevent people accessing benefits who allegedly don't need them. So a lot of the paternalism is actually what erects the barriers, and there's not a lot of evidence for a lot of that paternalistic nature of the system. But I think it's important to remember that complexity arises for a reason. We need solutions to deal with that realistically, and we should be very, very careful about thinking that there is a one-size-fits-all program. And in fact, what we saw through our analysis is one-size-fits-none. So I'll turn it over there.
Thank you, Lindsay and David. I appreciate that. Some very strong points that you made with respect to, the complexity of the system, the role of single working age adults, and as well as a very important history, I think, with respect to the federal and provincial governments and what took place in the mid 1990s with respect to both employment insurance and social assistance. But Garima, there's a lot to react to there, and you have some ideas as well. So over to you.
Great. Thanks so much, Colin. Thanks for having me, IRPP and Colin, and for hosting this conversation. I'm just going to share my screen now. So if you would just all bear with me for a moment and get this going. Great. I think that's working now. So thanks again, Colin. My name is Garima Talwar Kapoor, and I'm the Director of Policy and Research with Maitree. And in this presentation over the next 10 minutes or so, I'm going to try to also answer the question of whether a UBI would best address the gaps in our social safety net. In the 10 minutes that I have, this is what I plan to do, and this is what I plan to cover. I'm going to provide some reflections on Lindsay's and David's presentation, and then I'll move forward on a conversation on what we mean by a modern social safety net and the principles that ought to underpin this social safety net. And then I'll move forward on identifying the core issues in our social safety net, and then move on to whether, what the proponents of a UBI are looking for when they say that a UBI could best address the gaps that we face in our social architecture. And if we then compare what proponents of a UBI are looking for and compare it to the core issues that we face and the principles that ought to underpin a social safety net, I think that there is more that we should be looking for when it comes to a strong and modern social safety net. And so what I will conclude with are some remarks on what I think and what my team at Maitree thinks we need to develop for a modernized social safety net here in Canada. So quickly, I really enjoy the sunburst diagrams that Lindsay and David presented and developed as part of their BC Basic Income panel research, because what it really makes clear is that we do have a complex system of income supports and social services, and the interactions of these services and supports between services provided by the provincial government in BC and the federal government are really important to interrogate, and that's where a lot of complexity arises. And the story, or the sunburst in BC, if you were to replicate that same method, and you would basically get the same result for every single province and territory in Canada. The system is complex. And despite the complexity that we see across the country, there are significant gaps for working age adults. And these gaps are seen time and time again across PTs. I think that the comments made by David and Lindsay on the labor market realities are really important to centralize in our discussion of what a modern social safety net ought to look like. And I think we shouldn't forget that, when we think of what supports working age adults need in the face of a new labor market, that we can't also forget the cultural realities that pervade how we think of our social safety net. So often we think of significant gaps in our social safety net as as something that people ought to deserve. And if you're a working age adult, the idea is that you should be working and contributing to the tax base for all the social services and supports that people need. And that might be true when we had a strong labor market, and we do have a strong labor market. But with the increase of fissured workplaces and with the the decline of unionization rates across the country, what we've actually been seeing is that while gig work may not be permanent in somebody's life or doesn't contribute to a permanent sense of work, gig work is a permanent feature of our labor market, and is becoming more and more of a permanent feature in our labor market. And that's something important to centralize as we think about the different types of supports we need in the face of this reality. And ultimately, we need better labor protections and legislation and better public services for people. And I'll conclude with this. So in my mind, what we need for a strong and modern social safety net first has to start with the principles. And for us, it's important to strongly state that fundamentally everyone in Canada has a human right to an adequate standard of living, and that our social safety net has to be underpinned by a sense of equity, that our social safety net needs to provide a sense of adequacy, and that the dignity of people and communities is centralized in all of the programs and services that we develop in response to the needs of people. And when I think of the diversity of need, and I think Lindsay puts it well when she talks about the heterogeneity of Canadian communities and populations, I think that we need a social safety net that is made up of many strong threads and not a single thread. And so this is, my way of sort of making a symbolistic, perhaps, argument that if programs and social supports are the strong threads that we need in our social safety net, we can only have a net if we have multiple threads. And if we rely on one single thread, then the pressure that this thread would face would actually lead it to tear. To recap something that Lindsay and David talked about, but I think important to illustrate here, is just how starkly unattached single individuals who are not in economic families, but are working age, live in poverty. So this data comes from CIS data from Statistics Canada, and I've provided what the poverty level looks like across Canada for all demographics and age groups in 2019, and that hovers around 10%. But if we look at singles only, then we're hovering somewhere above 30%. And that's really important to recognize because the need is so great. Here, I wanted to talk about, just really centralize again, if income assistance and social assistance is the greatest or is the most significant program available to working age adults considered employable, then we need to know how poorly our social assistance rates fare relative to different levels of poverty. And here I've provided a cross-section of what annual total welfare incomes look like in Canada across jurisdictions. And again, I've only selected a few. And these total welfare incomes are not just the social assistance incomes that one could receive, but also other tax credits like the GST. And so you'll see in Ontario, once you take into account all of the sources of income supports that could be available to somebody, that you'd be at about 40% of the MBM. And if you're in Manitoba, if you take into account social assistance and other income supports, you're hovering at about 43% of the MBM. This chart, I think, is really important to take into account. So David and Lindsay talked about a little bit of the shift in what was happening in the mid-1990s around employment insurance and social assistance and how that affected caseloads. But at the same time, what was happening was a downloading from the federal government to provinces and then onto municipalities, largely around housing policy. And so what I've, in this graph, what you can see is for Ontario, what the single welfare income for on a monthly basis looked like for somebody receiving Ontario Works from 1990 through to 2019, and plotted that against what the average cost of a bachelor or one bedroom rental amount looked like. And you'll see that in 2019, while for a bachelor unit, while the cost of a bachelor unit is around $1,100 and just north of that, the actual welfare total amount that somebody could receive, or income support an Ontario Works recipient could receive, is only at about $800. And so while many of us talk about, you know, oh, you should not be spending more than 30, maybe, you know, in these days, 40% of your income on the cost of housing, here we have a situation where social assistance rates do not even come close to the cost of housing, or the average cost of housing. And now I'd like to talk about, so if we've talked about the principles, and we've talked about the problem that we're facing, and talked about working age adults, their levels of poverty, what they might receive through different sources of income. And in my mind, you know, one of the greatest challenges we face is around the cost of housing. We need to now ask ourselves, what do we get and what do we risk with a universal basic income? So I think it's important to say that, you know, for UBI proponents, the idea of a simple system that is meant to be adequate and is easy to understand is what's compelling about a UBI. And I get that. But I think that you could achieve you could still have a social safety net that is made up of the programs and services that people need, but still move towards a more simplified and adequate and easy to understand system. For me, the risks associated with a UBI include, and it's important to name, really discussing what's replaced or eliminated through a UBI. When we simply say, oh, a universal basic income could replace social assistance, well, I think it's important to also ask whether we're comfortable replacing the health benefits that are provided through social assistance to people living in poverty. Is that something that we're comfortable with? Would a check simply replace the cost of drugs or of medicines that people might have? Does it make sense if a basic income creates inequitable outcomes? We have a forthcoming paper coming out in a couple of weeks that does analysis of the PBO's recent costing of a UBI in Canada. And based off of some of the assumptions that the PBO has made on what could be replaced to create a UBI in Canada, we actually see that there's a transfer of income that occurs from the working poor to those living in deepest poverty, and not a transfer of income from those with the highest incomes to the lowest incomes. And so I'm not sure that that's the kind of system that we want to develop. Again, I think a question around what a basic income replaces is really important to ask, because it then compels us to ask whether it's actually adequate. And something that Lindsay and David talked about, and I think is absolutely critical, is for us to first ask, you know, what is the primary goal of the different programs that we're trying to create? Is it poverty reduction, or is it income stability and in response to income volatility? While you know, this is not something that gets many people to be a fan of mine, but you have to pick one. For every single policy priority, there has to be a priority, and there could be secondary effects, but how you design a program, how you design a system of supports depends on the primary objective that you're trying to achieve. And lastly, and quickly, I will just talk about what I think we need for a strong and modern social safety net. Again, I think we need a system of supports. We need to be clear about the principles that underpin a social safety net and work towards them. We need better income supports targeted by need. We need better work, and we need better public services. by better income supports targeted by need, we should fill the gap between OAS, GIS, and CCB with a working age refundable tax credit. We need to be thinking about what a basic income for people with disabilities could look like. And I know that there's a lot of work that's going on in the sector right now to help the federal government in sort of moving it along in developing this benefit, but that is really critical. But that, without thinking about better work and decent work, is myopic and inadequate. We need better labor protections. We need enhanced minimum wages. We need to enable and facilitate unionization. We need health and retirement benefits provided through good work or through the provision of portable benefits. And lastly, in the pillar of a modern social safety net, lastly, but certainly not least, we need better public services. We need enhanced and improved social assistance programs. We need to invest deeply in housing programs. Recent analysis that we've undertaken at Maitri shows that the Ontario government over the past several years has only been spending 0.3% of its total budget expenditures on housing programs. And if that is not an indictment of how not seriously governments have been taking our housing crisis, then I don't know what is. We need to modernize our employment insurance system so that it is reflective of the modern labor market. And we also need to strengthen the architecture that helps to fund provincial and territorial public services through a strengthening of the Canada Social Transfer. And lastly, we need to introduce important programs like pharmacare. We need to complete the work and the project of Medicare that started several decades ago and remains incomplete. And we need to ensure that the federal government's commitment made in its recent budget around a Canadian system for early learning and childcare, one that is grounded in quality and affordability and accessibility, is realized. So I'll leave it at that for you. That's my email if anybody wants to reach me. Thanks so much.
Thank you, Garima. That was a wonderful tour de force of so many different aspects of the social safety net to consider, and I really appreciated a number of the points that you made. One of them, before we get to the question and answer, but one of them I'm going to have to pick up on because I think it's really important. And you mentioned, Garima, this notion of prioritizing, and you can't prioritize everything. And so when we think about social safety net redesign and how to go at it, I think you mentioned two pieces. You mentioned poverty reduction versus income stability, and how do we look at it? And so, I kind of want to put that back, a little bit into your court, Garima, before I get back to the other two panelists, David and Lindsay. But how do you see it? Like, do you think that grosso modo, big picture, we should be thinking about poverty reduction instead of income stability? Or do you think that when we go through the social safety net program by program, that there are some pieces we should be focusing more on some priorities, and other programs we should be focusing more on income stability, for instance?
Yeah, thanks, Colin. I think it's the latter, right? In a social safety net, we need different programs and supports that meet people where they are, right? And address the diversity and need that people and communities and workers face. And so when I say, I'm trying not to be crass when I say we have to pick a priority, but the way in which we deliver our system of supports right now necessitates that we pick priorities. You're not going to be able to have a responsive UBI through our current tax system. That's just not how our tax system is set up. And if that's what we want to move towards, that is a conversation that we need to have with Canadians. It requires significant changes and investments in our income tax system. And I think that comes at a loss. Like, I think that we're forgetting the role that employment insurance can play in being a better responsive program for workers in the labor market that are facing the precarity that so many people are concerned about. But if we look at the successes of the CCB and we look at the successes of GIS and OAS, I think that there's an argument to be made that, not to say that we shouldn't be improving our tax system. This isn't an argument against that, but I think that you can reach people who are working age and living in poverty and perhaps not benefiting from EI because they are so distant from the labor market through enhanced social assistance and through a working age benefit that works better for people living in deep poverty. We've got some ideas on what that could look like and happy to discuss, but that's kind of where my headspace is at right now.
Great. Lindsay, why don't I go to you? What do you think? Poverty reduction or income stability? Do you think that what should we be prioritizing?
I think you need to look at those issues through an intersectional lens, because one of the things that we see is women value, especially women with children, income stability over, they'll pick that over variability. And that has a lot to do with the fact that you've got kids to take care of, and you cannot risk that stability in order to try to get a little bit more income. And so that actually has to be, and we did about 3 papers on gender-based analysis as part of our project. And, you do actually come to some real stark realities when you do that. So I think it's important to remember that what Garima is saying, that there's a trade-off between poverty reduction and income stability, is true, and they have different consequences for different people and how they will react to it. It's one of the reasons why we see women with children, particularly who are on income assistance, are eschewing work, mostly because the work is temporary. It's not high quality, and they are really worried, and rightfully so, of losing their income stability through the benefits that they have. And that is absolutely something that we have to keep in mind and ensure we address.
Thanks, Lindsay. David, I want to give you something to react to too. Garima mentioned a number of principles. She laid out 4 principles when it comes to rethinking the social safety net. And she mentioned dignity as being one of them. Do you think, potentially as economists and labor economists, we talk a lot about, incentives to work and the challenges of giving people, transfers of income and how that might affect their incentives to work. Do you think perhaps that, have we put too much emphasis on those incentives, or what's the role for dignity in kind of those discussions about people's decisions to work versus potentially, collect a check?
Yeah, that's great. Let me first say that I thought the same thing that you thought, that Garima's talk was a tour de force. We are in, I found myself, we were off screen, of course, but I was just nodding my head all the time. I was like, yeah, that's a good point, that's a good point. And we're gonna, as we go into the other webinars, we're gonna kind of go into some of the things that Garima was talking about. Part of the thing that we did do in the panel was in fact start off with a framework that is very much based in theories of justice. That was our starting point. It's how we took it through. If we come back to your question, I sort of agree that, I definitely agree that economists don't bring enough of that in, that we act as if you can untie justice from efficiency. And in fact, one cannot do that particularly effectively, once you look very closely, especially when you look at real world policies. It's sort of an interesting question, that question about labor supply responses. Do economists put too much emphasis on that? I would say most economists who actually look at the data don't, and that's because they know those labor supply elasticities are actually quite small. That when you actually go and estimate how much do people actually withdraw from the labor force in response to changes in benefits, the answer to that is relatively minimal. And back to your point, Colin, that almost surely comes because our notions of dignity, our notions of self-respect are very much tied up with our roles in work. And therefore, coming back again to what both Lindsay and Garima were saying, we need to think about systems that enable that. The EI system has moved in that direction in recent years, where you're able to both work and be on benefits, but our IA system is set up the other way. It's set up as if we need to punish you, that you need to be pushed into work, And that then, as Lindsay said, leaves people in benefits thinking, well, I can't take that job because I can't get back on. And therefore, back to Garima's point, it's not providing stability. It's maybe doing a little bit about poverty, but it's not providing the thing that people really want. And I agree completely. The place to focus is dignity and respect.
Great answer. I'm going to start to get into the questions, and I'm going to kind of take a question. I'm going to give it a little bit of a spin. But, you know, we have basic income-like programs for seniors and children. We have the old age security, guaranteed income supplement for seniors, and then we have the Canada Child Benefit for children. And both of those programs have been very effective at reducing poverty rates amongst people in those age groups. So why don't, and you know, and Garima partly answered this question, I'll take more details on it, but then why don't we just create a guaranteed annual income-like program for working age adults, maybe focus it on single people?
Lindsay,
David, go ahead. Why don't you take it first? And I want to get back to Garima.
I was actually going to turn it over to Lindsay. This one of the places that we often came to talk about was thinking about, for example, youth aging out of foster care, which is a huge, huge issue. You look at their high school graduation rates, the most shocking number I think we came across in all of the data work that we did was there's about 1,000 young people who age out of care every year in BC, but they make up 15% of deaths of people under age 50. And there, now you want to ask yourself, okay, so is the right way to go here to sort of hand a basic income to these people? But Lindsay, I think, has more insight on that.
Yeah, so one of the things that happened during the course of our work here is I realized how much my sort of experience, particularly in this area, was helping inform the debate. We often think of, you know, the 18 to 24-year-old, you turn 18, you're an adult and you can all take care of yourself. But when you've not had high quality parents, and when you have been abandoned by your parents, and that happened to me when I was 16, I was left on my own while I was still in high school. Money was important. I mean, I did end up having to work a fair amount when I was in high school and in university, but I needed parents. I needed somebody to help me navigate, and I didn't have that. And somehow it all worked out, but I wouldn't hold myself up as, you know, how you know, you just work hard and it happens. You know, there's a lot of barriers that, you know, emerging adults have to confront. And when they do not have a parental support network, there's a lot of issues, like how do you find an apartment? How do you sign a lease? How do you budget for a grocery bill? How do you make sure you don't kill yourself with salmonella because the chicken wasn't cooked properly? I mean, this sounds mundane, but as an emerging adult without a parental network, this is really vital stuff. And so, you know, just thinking that, you know, income, which again, it was important, but for particularly youth aging out of care and youth aging out of the income assistance system, we need much more supports. I mean, somebody has to play the role of an adult for them. And we cannot sacrifice that support system to assuming that income will solve all those problems.
And can I just say that we came to view that in a sense of the whole system. It's like, if you want to think about a basic income, you actually have to think about building a community. This comes back to Garima's point about dignity and equity. You need to build what people want around them for a successful and dignified life. And a check alone will not do that. And that, you know, Lindsay's example is a very clear example of that. What you need to do, and that's what we're going to talk about when we get to the third webinar, is really about how do you build a system that actually builds the community and the dignity into it, rather than handing people a check and saying, okay, you're autonomous now, go for it.
Great. Garima, I'm going to put it to you. You are the one who kind of introduced this, but, you know, is you know, this idea of a guaranteed annual income for working age adults, could you build up from the Canada Workers Benefit, which is a type of guaranteed annual income like program for working age adults? Is that something to build from, you think, or do you think we need to be approaching it differently?
Yeah, I think, given so when I think back to the table that I presented on what the total welfare incomes look like across several jurisdictions and how low social assistance and, if you add GST credits on top of it, how low it is relative to different levels or measures of poverty. I think that a case needs to be made that the federal government needs to play a stronger role in income supports for working age adults. I completely agree with what Lindsay and David were saying around creating systems, but I don't want to lose the fact that people living in deep poverty are facing deep poverty because they don't have income, right? And I think that if we're going to have, there's a polarity in the debate right now between UBI proponents and people that, like myself, that are skeptical and really hesitant about a UBI. And one way to sort of bridge that gap is to say, well, what is the role of the federal government in the stackability of different income supports that people can have, right? And so I think that the CWB, let me first and foremost say that I don't like the design of the CWB. I think this idea, and you were talking to David about it a bit earlier, around incentivizing people into the labor market is, to put it mildly, hogwash. And again, the design of the benefit in which you actually get the benefit in arrears. So you have to work a full year before you can actually receive the benefit. And do you even actually know that you get this, $1,400 benefit is unclear, because you're not deciding how much you're working or not based off of what you might get when you file your taxes a year from now. And so I think, but that's not to say that benefits like the CCB aren't important in providing that foundational support for people. And so when I think back to choices that the federal government made in its last budget, it decided to enhance the Canada Workers Benefit, and it extended, it expanded how many people or who could get access to the CWB. So now if you are a full-time minimum wage earner, you could receive some CWB benefit. And so they've expanded, I'm doing these hand gestures like people can understand what the graph I'm drawing in my head looks like, but more and more people can get access to it. But in my mind, what the federal government could have also done is increase supports for people who have the deepest levels of poverty, not start the benefit at $3,000 of earnings, start it earlier, start it at $0. And if you were to do that, you would automatically hit, depending on design choices, again, you would hit the people that have full-time minimum wage earnings, but you would also be able to affect the lives of those living in deep poverty, right? Like this income variability question is a question for people that are, again, that are termed the working poor. But if you're in deep poverty and for a variety of reasons aren't working, your income fluctuations are going to be less likely than somebody that is working full-time minimum wage. And we see this in duration of social assistance caseloads across Canada. So even though social assistance is meant to be a temporary support program, we're seeing people are relying on benefits for a longer period of time. And this again goes against the idea of meters, like let's cut how much people can get so that they are incentivized to work. But I think it speaks more about the realities of people, not just the labor market that they're working in or could be working in, but their inability to access safe and secure housing, any illnesses that they may be confronting that prevents them from working. It could be that their youth aging out of care. And so I think that, again, to put it succinctly, I think that there is a role, and the CWB could be a vehicle, and we're exploring that in our work. But it's not the same as doing a UBI, and that needs to be, I think, clear.
Thanks, Garima. And I fully understood the charts that you were presenting with your hands. There's no problem on that. I do want to, so I've got, some popular questions here, and I want to ask a couple of them to David and Lindsay. And this is a bit of a segue based on how Garima finished anyway, but, one of the most often talked about things when it comes to the issue of basic income and improving income supports through some sort of universal floor is the potential impact that could have on reducing people's healthcare costs and in terms of like improving their health by ensuring better access to housing and so on. Did your panel investigate that at all? Did you look at the possibility of healthcare costs potentially being reduced from basic income? How does that kind of factor into your thinking on these issues?
We did. We looked into some of the evidence that surrounds that for sure. I think one of the interesting things that we really need to do in this area is differentiate between health outcomes and healthcare costs. One of the things that is often done is people claim you're going to make people healthier, and then that's going to lead to healthcare cost reductions, and that's going to then, in some sense, partially pay for the basic income. From what we looked at, there's some evidence that you can have good health outcomes, okay? But you get those in part, and by the way, this is not just from a basic income, and this is one of the key things we have to differentiate between, because this often happens in this debate. Anything that is good for any income distribution program, whether it's coming through, as Garima said, through the Canada Workers Benefit, whether it's coming from EI benefits, whatever it's coming through, we see evidence that there's a positive income effect, and then everybody says, oh, well, that means we need a basic income. It's like, well, no, not necessarily. We need to think about which kind of program we want. But one of the things we see in the evidence is that there is a positive association between income and health outcomes. Part of that is because people with more income are able to better access the health system. And that means that, in fact, what you see is not necessarily healthcare costs going down. You may see them going up. So you need to differentiate between, it could be useful, but so could other income systems for helping with health. But don't expect it's going to then go and pay for your basic income, because as far as we can tell from the data, it's not.
Great, thanks, David. I'm gonna plow through some questions here because there's some really important ones. Precarity and precarious work. So you mentioned, David, you showed some of the statistics of some forms of self-employed workers and showing that there really hasn't been, major trends in terms of those numbers increasing over time. But isn't it possible that kind of post-pandemic, that advances in technology could create pretty significant shifts in terms of the size of that part of the workforce and the overall broader workforce? And then, of course, you mentioned the fact that there's a certain amount of persistency in that kind of precarious work. So don't you think that we shouldn't be trying to get at these issues now and try to solve these issues now, as opposed to potentially, downplaying them?
Yeah, but I didn't mean to downplay them in the sense, that was my sense of saying, like, quoting Leah Vasco to say, like, there is persistent precarity. What I think the key point here is it the case that technology is just going to drive us relentlessly to this position, and therefore we have to go to something like a basic income as the response? The question is, what is the right response to what we've seen in terms of particularly fissured work, declines of unionization? Is a basic income the right response to that? And I would argue that the answer to that is no. That if we reframe it and say, okay, it's not technology just taking off out of our control. That's not what's going on here. What's going on here has to do with our decisions about labor regulation. So yes, we should be making decisions. We should decide ourselves rather than wait for the courts or wait for Uber to decide who's an employee and who's not an employee. We should decide for ourselves that, for example, the workers in long-term care homes the long-term care homes themselves should have joint and several liability for them, not just the intermediate firms. We should make those decisions as conscious public decisions in order to take control of that future, instead of acting like it's about to run out of control for us and there's nothing we can do about it. That's a narrative that companies like Uber are trying to push, because they're trying to argue that we actually don't have agency in this policy area anymore. And I would argue that's not true. And if it's not true, let's address the problem directly and accept that a UBI is not the direct way to answer this, unless we think we have no control. And like I said, I don't think we do.
Agreement. Do you have anything to add there? I mean, we don't have great data with respect to, precarious workers. The data is very limited in terms of what we can say. But did you have anything to add there with respect to how to approach that, the policy issues facing precarious workers and the rise of gig work?
Yeah, no, I would just echo everything that David said, right? Like, I don't think that we should be waiting for courts to tell us what, who should be deemed and or not. Like, I think we intrinsically know that it's to respond to concerns that people have around precarity in the labor market, like the permanence of gig work in our labor market, I think needs to be understood by policymakers as so we can argue, about what data and charts are telling us. And then there's the feelings aspect that policymakers have to respond to, right? And the permanence that it feels like that gig work has, or the stronghold that precarious work has in our labor market. Again, we can argue, what it hasn't been increasing as a relative share of total income, or total labor, but yeah, I would underscore everything that David has said, and I think that we need to move strongly on labor protections. We need to unlearn some of the things that we've learned over the past 2 decades around what kinds of labor regulations would help create jobs, because we know that that's actually not true, and we need to push against those pervasive narratives.
Thanks. I have a question here on it's a data question. It's important that we kind of deal with this. It's a good forum for it. But Indigenous populations in Canada and data with respect to poverty, data with respect to issues in housing, there's some serious gaps there. What did David and Lindsay, what did you find in the course of your work and in terms of the challenges, facing policymakers in presenting and understanding some of the challenges facing Indigenous peoples through good data? And if you have any thoughts on that in terms of what we should be doing going forward, would gladly take that.
Yeah, so I'll start, and I'm sure David can fill in a little bit here. We actually had a very, very substantial project that was moving forward with us, looking specifically at Indigenous populations, and specifically on reserve Indigenous populations, because a lot of the urban Indigenous are sort of covered in the data, but on reserves, that's a real concern. Unfortunately, that's kind of work that you do face to face, and the pandemic made it such that work had to pause. That's being led by Anke Kessler at SFU. It is, I think, restarted, David, and I think the last conversation I had with Anke is that she's hoping to have the report out to the government, I think sometime in late summer, and then hopefully it'll be released publicly early fall. But there was, the pandemic really kind of affected a lot of work, and that would be one of them. But it is a very important question, because specifically when we're talking about on reserve, that's a federal responsibility. But the federal government typically delivers programs on reserve that mimic what's offered at the provincial level, so that if we can take down barriers to access in the provincial program, that should translate through to the reserves, because of how the federal government develops its programs for reserve areas in the province. But David?
No, I think you covered it. That's basically it. I mean, to do this right, has to be done completely interactively with the Indigenous communities, and that's Anke is working with a set of communities, and that's exactly why COVID stopped it dead, because it requires respectful, complete interaction.
And then if I can just, because I probably should have said this, when we're talking about Indigenous populations in the urban environment, one of the things, and again, we did cover this in a few of our gender-based analysis papers, we cannot disentangle colonialism from access to benefits. There is a significant interrelationship between those two issues. And when particularly we're seeing upwards of 40% of Indigenous populations, women who have children, not accessing the Canada Child Benefit, it has nothing to do with the fact that they don't know about it. It's just there's a long history of those women reporting births to the government, and the government comes and takes those kids away. So you have to really think about the institutional power struggle and colonialism, while also thinking about barriers to access, because it's not as simple as if you build it, they will come, because there's a real reason why they won't.
Thanks. We're almost at time. So what I'm going to do very quickly is I'm going to give everyone about 20 seconds to say one thing that they think should be a big takeaway for you. That's something that's meaningful for you, but also for the audience. It can either be, you know, something we should be doing going forward, where we should be focusing our efforts, or something that, you know, really jumps out at you in terms of what's central importance to the message you wanted to communicate today. So I'm going to go around the room before I say goodbye to everyone. So Garima, why don't I start with you? 20 seconds. Go for it.
I'd say that the pandemic has revealed inequities in our society. And if we centralize out of the four principles that I talked about, if we centralize equity as a principle in our social safety net, then I don't think that a UBI best addresses the gaps that we face. I think to centralize equity necessitates understanding diverse needs in our communities and our people. And I'll leave it at that.
Lindsay, you're up.
It's much more complicated than people want to believe that it is. And I think it's really important that we think about, there's a reason why we have a paternalistic system. And I'm struggling with understanding why people think we can just immediately blow that up and move all the way to the other end of the spectrum. And I think the conversations about CERB recipients particularly demonstrates that we have a real barrier to being able to treat people respectfully with or without a basic income.
David?
I'd just rather give more time to those two. But I just to echo what both of them said, I think one of the key messages that's going to come up in the second webinar, I believe, is if you think that the basic income is a simple solution to everything, it's not true. It's a different complex system. And then we need to ask ourselves which complex system provides the greatest chance of creating the kind of dignified society that Garima was talking about. And then in the third webinar, what we're going to do is put forward our notion of where some of those plans would go.
Wonderful. I'm going to wrap up. Thank you, Garima. Thank you, Lindsay. Thank you, David. Really appreciate you being with us today and for putting on really wonderful presentations. Very meaty, very substantive. There's a lot for everyone to take away. David alluded to it. We will be having upcoming webinars as well on the same topic. We'll be releasing some of those dates soon, so do please tune in. And thanks to everyone. Again, I'll let you get on with your afternoons. My colleague will be putting in the chat box a survey for you to respond to. Please take just a couple seconds and fill it out. We'd appreciate it very much. Thanks for joining us at the IRPP today. Thanks, everyone.
Thanks so much.
Thanks again to all our panelists, David, Lindsay, and Garima. And thanks, moderator Colin. May the 4th be with you. Thanks everyone for joining us today, and please stay tuned to our social media channels for future IRPP webinars. We're under the handle @IRPP.